Hello and welcome to an introduction to psychology for people with lung conditions. My name is Kathryn and I'm one of the clinical psychologists that works in the medicine psychology team at Mid Yorkshire Hospitals. Now you might be thinking, what has a psychologist got to do with my lung condition? Or do you think this is all in my head? Well, our body and our lung condition can feel very separate from what's going on in our mind, such as thoughts and emotions. Psychologists like me play an important role in helping people to prevent and manage chronic diseases just like lung conditions. In addition to our general training in the treatment of mental health problems such as anxiety or depression, many psychologists are also specifically trained to help people cope with the impact of living with a chronic illness. We know from both scientific research and from experience of speaking to people who live with lung conditions that there are strong links between having a physical health problem and changes in our mind, our thoughts and our emotions. Over the course of this presentation, I hope I can explain to you a bit more about these links. Let's start with an exercise. Many people might assume that the mind and the body are quite separate things. Pause this video for a few moments to think about the following situation. Think of a time when you were in an everyday stressful situation, a time where you felt nervous but not completely out of control. For some people that might be making an important phone call, maybe sitting an exam at school or taking a driving test, going to a job interview, or maybe you were asked to make a speech at a special occasion, a party or a wedding. Did you notice any physical sensations in your body, bodily symptoms right before or during that situation? If you're watching this video in a group, the course facilitators will pause the video whilst you think of your answer. But if you're watching this at home on YouTube, you can pause the video yourself and jot down a few ideas on a piece of paper. So what did you come up with? Here are some of the common responses. When people are stressed or under pressure or nervous, they tend to notice their heart racing or pounding, a tightness in their chest, or shallow, fast breathing, churning, butterflies in the stomach or indigestion, needing to go to the toilet, feeling hot, sweaty, especially sweaty or clammy palms, and going red in the face or red on the chest. Feeling quite shaky or weak in the knees or almost dizzy. And finally, racing thoughts or having a really buzzy mind. For some people, that can mean their mind goes almost completely blank, just completely overwhelmed by everything that's running through it. There's certainly not an exhaustive list. You might have got some other ones down there as well. But one of the things that you might have noticed here is that some of the bodily symptoms that we experience in a situation that makes us nervous or stressed or anxious are very, very similar, or in fact the same as some of the symptoms that you'd experience as part of your lung condition, particularly things like breathlessness or being tight in the chest. In a situation where you feel nervous, these symptoms are caused by a biological mechanism called the fight or flight response, sometimes also known as the threat response. In response to a threat, the body releases a cascade of chemicals from the brain down into the body when we're in this stressful situation. And we're going to come back to the role of fight or flight responses a little later in this presentation. But for now, and as you understand from the exercise, rather than the mind and the body being completely separate things, actually the mind and the body are really closely linked together. We can only truly appreciate and understand our overall well-being if we take into consideration both mind and the body and the way the two of them are working together. They're two sides of the same coin. So let's have a look at each of the sides in a bit more detail now, specifically thinking about living with a lung condition. So here's a second exercise to get you thinking. Let's start with the body and the physical effects of a lung condition. If you have a think about someone living with a lung condition, and this doesn't have to be yourself, you could also think more generally about other people experiencing things like asthma, COPD, emphysema, pulmonary fibrosis or something else. What sorts of physical difficulties and challenges might someone with a lung condition be living with? And again, pause the video here whilst you come up with a short list. Here are some of the answers that I have. Again, you might have different ones, which is okay too. Unpleasant sensations like breathlessness, coughing, a tight chest, or feeling fatigued. Difficulties with moving around, with taking part in different activities. Maybe not being able to go to work anymore or having to stop certain hobbies. Changes in the role that we have in life, especially not being the same parent or grandparent or partner that we wanted to be. Changes in sex life, particularly maybe taking on a more passive role during sexual intercourse. A condition that is changing over time, either worsening and maybe might lead to a shortened life, which of course is a very distressing and painful thing, or a condition that's fluctuating, isn't the same from one day to the next, might be quite unexpected or difficult to predict. Some people might notice differences in their memory, concentration, or other thinking skills. Or it might be that the treatment or medication is unpleasant or has difficult side effects. Now let's look at the other side of things. Again, pause this video briefly and think about the following question. If a person is living with that lung condition with all of the physical effects that we've just described, all of the impact on the different areas of their life, what sorts of thoughts, feelings and emotions might you expect that person to feel? What did you come up with? Well, here are some of the things that people come to psychology sessions discussing. Feeling stressed, feeling under pressure, or feeling overwhelmed by lots of different demands. Feeling worried, feeling anxious, or feeling on edge. Feeling down, depressed or hopeless, maybe thinking things of themselves like, I should be doing better, I shouldn't be like this, I need to get a grip. Feeling really angry and irritable, feeling upset that things are unfair, that they shouldn't have to live like this, feeling really frustrated with themselves or others. Some people describe a feeling like grief, that they've lost something or a part of themselves, or that things have changed in a way that they didn't want them to change. Or finally, feeling scared or frightened that something bad is going to happen, particularly that they're not going to be able to get their breath, that they're going to be sent to hospital, or ultimately that they're fearful they might die. And of course, these are all really understandable and normal ways to feel if you're living with all those physical effects of a lung condition. So I hope that you can see from these exercises that we've done that there's a strong link between the body and living with a lung condition and the mind and our thoughts and emotions that we have in response to that. And overall, living with a lung condition means looking at both sides of that. And that link can work in two different directions. On the top row here, we can see a person who was living a normal, regular life, their usual ups and downs, who then developed a lung condition. The lung condition starts impacting on their life, and as a result, they start feeling lower in mood, more worried, more stressed out. On the bottom row, we've got another situation. This is a person who is already having a really difficult time in their life. Maybe they'd had a previous experience of anxiety or depression in the past. Maybe they'd already been through some really difficult life circumstances. On top of that, this person then develops a lung condition, and it's just too much to handle on top of everything else. They're finding it really hard to manage a lung condition on top of all of their other demands in life, and that's having a further impact on their own mental health. Or things might be a bit more complicated than that. Here's an example of a sort of tricky, vicious cycle that people can experience when they have a lung condition. At the top there is the lung condition itself, and one of the key symptoms that people struggle with is breathlessness, not being able to catch a breath. And when breathlessness is triggered, people might experience some worrying thoughts. They might think, oh no, not this again, I can't breathe, I need to get help. And that might start to make them feel quite panicked, quite nervous, or quite stressed. Earlier on, remember we talked about the fight or flight response. when anybody is put under pressure, if they're stressed or nervous, the body reacts automatically with that cascade of chemicals, which causes symptoms like heart racing, breathing changes, sweaty palms, getting hot and dizzy. Obviously, for a person that's already experiencing breathlessness associated with their lung condition, that's going to make the situation even worse. That might have a knock-on effect again on what they're thinking and feeling. They might start to really, really panic. I need to get out of here or I'm going to die. As a result, that person is likely to stop doing whatever has triggered the breathlessness. That might be in the particular moment, so they might stop doing whatever activity it is, they might sit down, they might go outside. But it might also be in a wider sense as well. It might be that in future they say no to the same activity, or they avoid going to the same place if they think it might trigger the breathlessness. And on one hand, that works really well. People often feel very relieved. They're not breathless anymore. They'll probably think to themselves, okay, good, I'm safe now. But you might also notice more uncomfortable feelings, feeling pretty annoyed, angry, frustrated, or upset about things. I should have been able to do that, or I'm missing out on things that I used to really enjoy. And if that cycle repeats itself over and over, day in, day out, over different months, different years, different situations, you might find that life is becoming smaller and smaller and smaller. The list of things that you're avoiding or saying no to might get bigger and bigger and bigger. And if anybody's leading a more limited life, then we might expect that to have more low mood, less motivation, less self-confidence, and just generally do a lot less of the things that make them happy. Now, this cycle might resonate with some of you. It might be recognisable. You might have noticed you've been around this cycle yourself. And let me tell you, it's a really normal and understandable experience for people who live with lung conditions, and one that your whole care team, and that includes the psychology team, are here to help you with if needs be. If you are experiencing mental health difficulties associated with your lung condition, or feel that that vicious cycle describes what's happening to you, then please know that the psychology team are here to help you. We always start by offering you an assessment appointment. Assessment might sound a little bit scary, but it is simply a conversation with one of our trained psychologists. They will find out more about your difficulties, who you are, and why it seems to be that you're getting stuck. They might also ask you to complete some psychological questionnaires, which give a bit more detail on the things you're finding difficult. This process usually takes 1 or 2 sessions to complete. At the end of the assessment, the psychologist will aim to have a good understanding of you, your difficulties, and come up with a plan alongside you, which helps to get unstuck with this. For some people, that might be some advice that you can try out yourself at home without needing any further psychology appointments. For other people, it may be that you wish to have a further set of sessions with the psychologist of psychological talking therapy. This involves holding regular appointments with a psychologist in which you'll spend more time together, really getting to grips with those strategies that will help you become unstuck. The important thing is that the psychologist will work with you individually to make a bespoke plan that meets your needs. There's no one size fits all from psychology. If you would like to start with one of those assessment appointments, then please speak to one of your healthcare team within the hospital and they'll complete a referral form on your behalf. If you're unsure about whether psychology can help you or not, you can always talk it through with one of your care team, or we'd always recommend that you just get in touch and try out one of those initial assessment appointments and then see if you'd like to continue things after you've spoken things through. It's always completely up to you whether you decide to proceed after this, and all of our sessions are private and confidential. We'd be happy to discuss any concerns or answer any questions that you have about psychology before you decide. If you do decide to make a referral to psychology, we'll send you a letter in the post asking you to confirm that you do wish to be placed on our waiting list. And you can also let us know if you have any additional needs at that point too. Some people experience mental health crisis in which they have thoughts about ending their life or of harming themselves in some way. If you experience a mental health crisis, please seek urgent assistance via your GP, your local single point of access service, or you can receive free, confidential emotional support from the Samaritans. If you are at immediate risk of harm, then you must attend your local emergency department for emergency advice. Contact information for the crisis support services are in the description of this video or are available directly from your group facilitators. Thank you for listening and taking part in today's session. I hope this has been a helpful introduction to explain how physical health and mental well-being are linked together and how a psychologist could help you if you're feeling stuck with your lung condition. From all of us here in the Medicine Psychology team, we wish you all the very best for the future.